That feels nice, actually.
Glad you think so.
It's
so do I.
Such a release. Woo.
Yep. I'm going to take this. I'm going to pull this shoulder. Jess actually does have quite a bit of tension in that left side, upper, lower. Big breath in and all the way out. Okay, all the way out. Good, good, good. There's two. And all the way out. Good. Very good job.
And I teach singing to kids. I'm a singer myself. They were like, Jess, can you just sing the whole song to us? You're so good. And then one other kid was like, okay, but we've only gone through half of the song, so why don't you just sing the entire other half of the song? And we're basically still learning how it goes. So I was like,
that kid's gonna be a politician. that kid's gonna be a lawyer.
Okay, fine, I'll do it. And they all were so excited.
Jess.
Hi.
Good to meet you today.
Nice to meet you too.
Jess is an actress and a musician and just an all-around creative who's in today dealing with some kind of upper back discomfort. I'm going to let her talk about it and take us through it. So Jess, why don't you go ahead?
Yeah, so I have some pain and tension here in, like, I don't know what, the traps area, I guess.
Yep, you got it.
That I've had since I was a kid, but it's been getting really bad lately, and I've been noticing that it's been rising as a hump. I don't know if it's because I'm rising my shoulders now more or anything like that. And my other thing is that I recently started weight training, which is really exciting.
We love that here.
Woo!
Yeah.
But I am now experiencing kind of like a pop in like the back of my upper back.
Okay.
And I don't know how else to describe it, but it's not necessarily super painful. It's just sometimes a little bit uncomfortable, and I have to kind of like twist my neck in a certain way so
Try
I
to
can
like
just
get rid
crack.
of it. Yeah. Okay.
So yeah, that sometimes happens after a while of lifting weights, and the other day it was like so many of them at once in one day. So
you were doing a lot of what we refer to as self-adjusting then, like the adjusting means the cracking, right?
Yeah.
And did you find those to be painful? Do you have concerns about them? Do they get in the way of your weight routine? Like
they're not necessarily painful, but it's just concerning because I've never had them before, and so many at once. And sometimes when I get under the bar to do like squats, I have to like quickly do it.
Shift things around
before I go down. So yeah, I figured might as well check it out and see if there's anything wrong now that I'm young and can and can work on these issues now before I get older.
Okay, so really you're saying that the problems are local to your kind of upper back, almost like traps region. Are you getting any kind of like tension into the neck, any kind of headaches, anything above that?
No, I don't get headaches very much.
Good.
But I have found in the recent like year, it's not very often, but sometimes I do experience some lightheadedness.
Okay.
I don't know if that's related or not.
When did you start the weight training again?
I started weight training about 4 months ago.
4 months ago. Okay, so like temporally it doesn't line up. The one thing, I do have quite a few patients come in here and tell me about various pops or cracks or sounds that their bodies make, and it can be understandably concerning because it is a weird sound, and you haven't heard it up until you hear it, right? Usually these sounds aren't cause for concern, okay? This is simply your body readjusting, specifically your joints readjusting to whatever stress it's then being exposed to. So in the case of like being a new weight trainer and you haven't really had this kind of cracking or this popping happen to you before, well, you're also doing a new heavier activity, right? Which your body may or may not be used to and therefore needs to self-correct in some manner. So unless that popping is actually painful or like not necessarily distracting but interferes with your activity in some kind of way, it's not something to be stressed about. Now that being said, it's happening for a reason, and it's happening because whatever you are trying to achieve, whatever movement or position you're trying to get into, you're simply not mobile enough to get into that without getting the release, right? Which is fine, all right? Like most weight trainers, we suck at mobility because we're impatient. We just get into it because we'd rather get under the bar than on the stretch mat. That's bad. We should be more mobile, guys. So that one thing we can talk about today is focusing a little bit more on that mobility, but also therapeutically opening things up rather than unintentionally, if that makes sense, okay? So any questions about that at all, or no? Okay, so what we're going to do today is, unless there's anything else you want to know, no, what have you, Have you tried or have you seen anybody regarding this issue yet? Or just...
No,
I'm
you're the first one.
Okay, you're the first one.
No pressure.
You saw a chiropractor before. I know you mentioned that his appointments were rather short, though. And you're
Yes.
looking for something a little bit more, not necessarily intensive, but holistic or broader.
Yeah, something that is a little bit more in depth.
Okay, good. So... I like to think you're in the right place, right?
Yay.
But what we're going to do today is we're going to do the physical exam. Then
Okay.
we'll get into the kind of anatomical explanation, and we'll get into treatment. All right,
Great.
does that sound good? Perfect. Jess was saying that she's getting a lot of upper back tightness as well as kind of the traps region. Now, we're very familiar with the traps at this point, that kite-shaped muscle that starts all the way at the top of our head, flares out into our shoulders, and then comes back down into our back. So, good form to check the entire region of that muscle, including the neck. So starting off, I'm going to get you to bring your chin down to your chest for me, okay? As far as you can go. Does that provoke any kind of the stiffness or discomfort you're getting in your upper back?
No.
No? All right, come back up, look towards the ceiling for me. How about with that?
I just felt a little bit of like almost a crack up here,
Okay.
like a bubble up here.
All right, she's pointing to her left levator scap insertion. Again, I'll throw a picture up there, but that's another muscle we should all be pretty familiar with by now. I'll get you to rotate your head as far as you can to the right for me, please. We can get to 85 degrees. That's really good. Go as far as you can to the left. We can get to about 70 degrees. So a little bit of an asymmetry there, not by much. That is on the same side where she's feeling the pinching. So funny little relation there. I'll get you to bring the right ear down to your right shoulder, please. Yeah, perfect. All right. And actually, it's kind of hard to tell with such long hair here, but
okay.
you can get to about 45, 50, and let's go to the left. 45, 50. So the lateral flexion is equal and symmetrical bilaterally. The rotation there is a bit of an asymmetry. Arm like that, and just relax as best you can. Relax. Good. There we go.
Whoa.
That's not on purpose. Drop the arm. Let me hold it. Good. These are always so awkward to do from this angle. And bring this out. Where's that bicep tendon? Good. There we go. Drop that. Good. There we go. All right. Bring both arms up for me. Keep them there, okay? Yeah, don't let me move them. Good. Arms forward, curl backwards. Turn over, curl inwards. Fingers curled, keep them like so.
Ooh.
So strong. Look at that.
Thank you.
We're caving a bit, but that's okay. Turn over, and please gently squeeze my fingers. I have to always say gently now because I had a patient almost break my fingers one time. I need my
squeeze
hands.
it that strong.
Oh, this guy, he was like a welder or something. He had
okay.
strong fingers. Okay, perfect. Well done. Yeah. Normal upper limb neuro. Good. Good. Sorry if that one hurt. Felt like I hit a bone a little bit there.
No, you're good.
The hammer's made of rubber, so that shouldn't actually hurt anyone. Good. Good.
Oh.
Nobody likes that one either.
What is that?
That is something referred to as Babinski's test. I'm doing a lower limb neuro. It's not 100% necessary in this case because it is primarily an upper back complaint, but I like to be really thorough with my with my neurological exams. I do find that neuro is often underappreciated by a lot of different traditional medical practitioners, and I've had to send patients back who are testing positive with things like Babinski's and Hoffman's reflex. Now, that test is for something referred to as an upper motor neuron lesion, which is a really fancy way of saying something wrong with either your spinal cord or your brain. I've only ever seen it positive, meaning like it's bad, twice in here, and it's I'm thankful that I did them because clearly they were missed beforehand, so it doesn't feel good. You were normal. When I do this, your foot actually curves downward. In abnormal cases, it flares upward, but you're totally fine, and I'm just being thorough with that. So.
Very cool. Thank you.
So once again, Jess was mentioning that her issue is primarily in the upper back, this region here, and a little bit into the left scap insertion. So as we're very familiar with on this channel, we always want to check sections above and the sections below any kind of area of dysfunction, because anytime we do have a focal issue, we get compensation above and below. So we will be checking her neck as well as her kind of upper lower back today. So let's just get started with it. Feels a little ropey there, but are you left or right-handed?
Right-handed.
You're right-handed, because you're getting a lot of tension on your left side for whatever reason. Usually we have more tension on the side of hand dominance, but that's not the case here, so I'm just curious as to why that might be.
Well, lately I've been having more ease with lifting some weights on my right side than on my
my
left side than on my right side.
Okay.
Which is interesting. I don't know what.
If you're lifting heavier weight on one side, that could be why you do have more tension on this side. But I know a lot of people, like if they're right-handed, they'll use their right hand for their keys and carry heavy-ass groceries with their left hand, and that can kind of lead to asymmetries. But I'm not sure if that's what we're dealing with here. Oop, gonna release. I should probably talk less. Yeah, that there. Okay, so that feels like a rope. You can't really see it because my arm's in the way, but that's almost like first rib territory actually, so I might be hitting that later. Okay. So we're going to go in for that T-spine kind of manipulation adjustment now. I was just about to tell Jess that before you adjust someone for the first time, there's no way to know how much force they actually need to go. Okay, I have 300-pound men that come in here who I could quite literally sneeze on and they would release. And I have 100-pound girls who I need to all but body slam in order to get something to go. I'm not going to body slam you to start, okay? We're going to start with a more controlled thrust. So we're going to start light, and if you don't release, we're going to add a little bit more to it gradually, okay?
Okay, sounds
So
good.
what I need from you, you have been adjusted before, but what I need from you is to take a big breath in and then all the way out. And then just relax into the table. Wow, we had a lot before I even did a push, so this is very much a sneeze case. And all the way out. Good stuff. I'm going to take the mic here for a second, actually. We're going to move this over here. And take a breath in, please. And all the way out, and I'm going to turn your head. All the way out. Good. Okay. So breath in, and all the way out, all the way out. Good, 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 good. Nice. Okay. I'm going to pull this shoulder. One thing that was discovered on palpation was that Jess actually does have quite a bit of tension in that left side, upper lower back. As I mentioned, she felt quite tight on the left side, which is weird because she's right-handed, but all the same. So what I'm going to get here is I'm going to get you to take a big breath in and all the way out, okay? All the way out. Good, good, good. Nice. And one more in. All the way out. Good. There's two. Interesting reaction. Thank you. You okay?
Yeah, I'm
good. Perfect. And we're going to scooch the hips towards me, please. Good, thank you. And I'm going to take this, we're going to pull this to your shoulders and just crowd it. Nice. You can hold your elbow right there. Good. And I'm going to get you to take a breath in. And all the way out. Good. Very good job. Good.
Thank you.
So over the summer, I was on TikTok.
Okay.
And I got onto the side of TikTok where I went onto like chiropractors and everything.
Mm-hmm.
Oh, I feel some tension there. And
Me
I
too.
found someone who is a chiropractor who says like how chiropractors shouldn't be touching your neck area and like adjusting there because it can be quite dangerous. So for someone who's just watching that and learning about that, like what is your response to that, and how can you make someone feel more easy when it comes to neck adjustments? Because now I'm scared.
Okay, there's a lot to deconstruct there. Because first off, TikTok is definitely known as a reliable source of information for all people, 100%. And of course, that's complete sarcasm. But you know, the point does still stand that getting your neck adjusted or cracked can be kind of a weird thing to even consider if it's not something you do 30, 40, 50 times a day, such as a chiropractor, right? Now, you're an actress, so you're clearly a fan of movies, right? You will go watch whatever action flick and you'll see either like what's their name, James Bond or Black Widow, Scarlett Johansson, somebody snaps somebody's neck and that person is dead, right? Like that's not that is not a good thing to visualize when you're in this place,
Yeah,
right?
I watch
Now,
a lot of Vampire Diaries, so they do that a lot.
Is there a lot of neck snapping? Yeah. I don't, okay, but I'll take your word for it. Now, my response to this chiro saying that you shouldn't be adjusting other people's necks, my response, I'm interested to see why it is that they're saying that, because there is a huge body of evidence to suggest that this is a totally safe thing to do, okay? And I can pull up this, I'll even link the studies actually in the description below for anybody who likes to read that kind of material. But yeah, you're right, it is still a dangerous thing to do. Like I say, in all of my consent forms, I usually do these off camera, but they still get done. Chiropractic treatment can aggravate a stroke in process, which is the thing that most people worry about when they're getting their neck manipulated. But that's why it's important to do a full, thorough physical assessment, including a neurological exam, alongside screening for DANS. DANS is an acronym looking for all the top or most likely symptoms of an early onset stroke. Now, that being said, I would also say to this chiro that Advil can cause liver failure, right? It all depends on who the individual is that you are treating, right? For example, like you're what? You're early 20s, you're fit, do you smoke? No, you don't smoke, right? You don't have any of the kind of things that I would, and you have none of the DANs present. I didn't explain to you what they are, but I checked for them myself, and you're a clean neuro. You have nothing, in my opinion, to be concerned about with this treatment, okay? Because I did the full exam, I did the full history, and I've found it to be safe, all right? That being said, if I had a 350-pound man, history of stroke, smokes a pack of cigarettes every day, never active, I would be more wary about that. And I would be sure to walk them through the increased risks because they need to know. As a patient, that's their right? You can always say no to this. There's no pressure there, but it does. You need to find the patients where the benefits outweigh the risks, for which is most commonly the case. Is that going to answer your question?
Yeah.
Yeah? Okay, good.
Yeah.
Hope you're feeling comfortable today.
Yeah, that makes me feel better.
Good on you for being healthy, young, and non-smoker. Okay, how about that?
Well, smoking is bad for the vocal folds, so, and I'm a singer.
Of course.
So
that's why. That's the reason
can't
that you don't
risk it.
smoke, right? That's the reason. All right. Well, anyways, there was quite a bit of tension. I think it was on the right side, but also some on the left. So we'll just start with the left because that's where the microphone is.
Okay.
All right, so perfect. I'll just get you to relax into this hand as if it's a pillow, okay? Good.
Right.
There's a little one right there. And I'm going to try for one more up top, okay? I'm not sure if it's there, but it does feel like there might be something.
Woo.
Yep. Well done. Okay, we will switch sides with the microphone now. That would make a good educational reel, although I kind of was long-winded about it, so I'm going to have to figure out how to cut that down. Oh.
My question was also long-winded, so it's okay.
Yeah, no. It is a loaded question. It's a hot topic, so I'm actually glad we were able to talk about it on camera. The internet deserves to know.
Mm-hmm. That feels nice, actually.
Glad you think so.
It's
so
just
do I.
Such a release.
Yeah. No, there's nothing that quite mimics it. There's like 100 different kinds of massage, 100 different kinds of stretches, but nothing really opens the joints in the same way that getting adjusted does. Now, some would argue that there's like different ways to open the joints, but like at the end of the day, potato, truthfully. Yeah, that's, I explained to Jess off camera what these are, but the gua sha technique, the Graston technique, whatever you want to call it, works on the fascia, right? Breaks that up. A lot of traditional massage does not focus on that, but that's why I feel a lot of people like coming back is because a lot of practitioners ignore it completely. But anyways, let's get into it.
So the other day when I was teaching some kids, I work with a company and I teach singing to kids. I'm a singer myself.
Okay.
And the way we teach is we do a lot of call and response. So
Okay.
I'll start singing a lyric of the song and then they'll repeat it and then we'll move on to the next lyric and so on.
Interesting.
And
okay.
so I was singing, we were working on the song called Ain't It Fun by Paramore.
Okay.
It's like a fun pop song.
Well, ain't that fun? Get it?
And
Okay.
as I was teaching these kids, they were like, Jess, can you just sing the whole song to us? You're so good. And I was like, guys, I can't do that. I'm supposed to be teaching you. This class isn't about me. And they were like, no, please. Like, all of the kids started. And mind you, there's like 18 kids, and they're about like 13 years old. And they were like, no, please, you're so good. Like, we really want to hear you sing. And I kept being like, no, this is my job, guys. I have to teach you. And then one other kid was like, okay, but we've only gone through half of the song. So why don't you just sing the entire other half of the song? And we're basically still learning how it goes. So I was
that kid's going to be a politician. that kid's going to be a lawyer. They're going to be some kind of,
Yeah, so I was like, okay, fine, I'll do it. And they all were so excited. So I sang the whole other half of the song. And they just applauded like crazy. And one of the kids was like, you're so good, you could sell more tickets than Taylor Swift and Ariana Grande combined.
Oh boy.
And another girl was like, how do you sing like that? Who taught you? And like, I know I'm a good singer, and I've trained for it most of my life, so I feel very confident in my skill of singing. And so I do get compliments a lot on my singing, but there was something about hearing from these kids.
Say it, yeah.
Because I have singers that I look up to as well, that I'm like, I want to sound like that, and I want to be able to do that. And it's just incredible and so heartwarming to me that there are people that hear me sing that go, I want to sound like that. It just like made me...
Oh, absolutely.
You know, I'm like, wow, it's just so wholesome. And now I'm like, I love these kids.
when you work with kids, I used to be a swim instructor, okay? So I used to work with like little kids all day long. And when you work with enough kids, they will start to take you on as their role model or their goals in a lot of way, right? So in this case, it sounds like that's kind of happened to you. And it's a really endearing feeling when you have this little, vulnerable and happy creature that looks up to you as if you're like their star. It's like, oh, well, maybe I am pretty great, So I'm happy that happened, and it seems like it had just as much an impact on you as it would have on them as well.
Yeah, I'm gonna say like it made my week. Like I haven't stopped thinking about it.
What's your favorite song to sing?
Oh, there's so many.
You had to pick one.
Like, if I had to pick one that I could sing for the rest of my life?
Or just one to sing later on this channel.
Oh, I could sing for you.
Sure, absolutely. We can do that in the impressions segment, but you got to pick a song.
Oh, okay, well, I'm going to tell you multiple. My go-to karaoke is the Before He Cheats.
Okay.
My go-to music theater audition song is Everything I Know from a musical called In the Heights. It's like a tear-jerker.
I unfortunately do not know that one. I'm not very rehearsed in musical theater.
That's okay.
Good use of the word rehearsed, though, Adam.
It's definitely my go-to, though. And I don't know, I love singing so many things. I love singing Paramore, because I am a huge fan of Hayley Williams. I love singing... What else? Taylor Swift. I love singing John Mayer. I don't know. I can sing anything except like Screamo. And,
I was about to say Screamo.
And I'm not a very good rapper.
What? I was gonna ask for Mockingbird it's Mockingbird. Anyways.
Yeah, I'm not a very good rapper, but I can rap Alexander Hamilton, like the musical. But I can't really rap otherwise. Yeah.
Well, think on it, okay? And we can sing later, because now, you can sing, excuse me. I was an okay singer, but then I unfortunately hit puberty, so...
No, I'm sure you're still
That'll ruin it for her. I've been told that I'm above average, but that's it. Period. Like, not great, but definitely I can carry a tune. That's about it.
Oh, well, that's good. Yeah. That means that you can become a great singer.
Well, you want to coach me afterwards?
Happily.
Oh, looking forward to it.
Can I ask a question?
Of course.
So you were saying that it's kind of like gua sha, but a different intention, right?
Yeah.
So what is the intention of this one?
So, like I briefly explained at the start of this start of this, I guess we'll call it a cut. The reason I like these tissues so much is because they focus on a tissue known as the fascia. Okay, now have you ever cut up a chicken breast?
Yes.
Now you know that kind of gross translucent layer that sits on top of it that you kind of got to peel away?
Yeah.
That's fascia, okay? And we have fascia in our body. And it's relatively newly known what the role of this tissue actually is, but the role is to help our muscles, and indeed all of our tissues, which it encapsulates, to slide against each other in a frictionless environment, okay? This is obviously important because if we develop friction between our structures on movement, we perceive that as reoccurring stiffness, injury, or pain. So fascia, it sits on the surface, right? That's why if we do like a deep tissue massage, it doesn't actually work the fascia that much. It works the muscles well, but not the fascia. So if the complaint is fascial, you're kind of ignoring it in that case. Fascia, because it's superficial, responds better to sustained superficial pressure, for which the tool is very good at doing. Now with this, you are getting some redness here, and a little bit here too. It's referred to as petechiae, and that's indicative of fascial adhesions, which is the beginning of the fascia kind of tightening up, being released. Okay, so you do have a bit of a fascial component to this issue. I wouldn't say that it's all fascial, but it's definitely there, and it's playing an element, so it's good that we're doing this today.
Oh, well, thank you.
No problem. Thanks for asking. That actually feels like a guitar string. Do you have any requests?
For music?
Wonderwall? Huh? You got the joke. Good, I was worried you wouldn't.
Do patients ever fall asleep with that?
Oh. Not this, but the tools that we just used, yes, all the time.
Yeah, it was really soothing.
Why do you think so?
This is soothing too.
It's a little too noisy to fall asleep.
Yeah, but it feels nice.
I do a lot of soothing stuff in here, apparently. As we mentioned at the start, Jess got a problem at the levator scap insertion. That's a muscle that I really like to hit with MRT, so we're going to be doing that for the left scap as well as the upper traps in this region. So let's start with the left side, because that's where she's feeling it primarily. I'm going to get you to look up and to the left for me. Good. I'm going to take the people's elbow. I'm going to put it right there, and I'm going to get you to slowly look down into the right for me, okay?
Oh, into the right?
Yeah, slowly down into the right. So this is usually where the soothing stuff stops, and it's replaced with just pain, FYI.
Okay.
It's not painful yet.
Good. Up into the left. Come right back. Yeah, good. And now slowly down to right. Good. Up to left. Slowly down to right. And up to left. Slowly down to right. Ooh. Good. Face forward. Now please tilt your left ear to your left shoulder. Now slowly tilt your right ear to your right shoulder. Good. Left to left. Right to right. Left to left. Right to right.
Ooh.
That's a spot, eh? Mm-hmm. And left to left. Right to right.
Mm-hmm.
Left to left. Last one, okay?
Okay.
Right to right. Good. Alright, now same deal on the other side, okay?
Okay.
Gonna get you to look up and to the right for me, please.
Mm-hmm.
And now slowly down to the left. And up to right. Slowly down to the left.
Mm-hmm.
And just keep going up to right. Slowly down to left. Up to right. Slowly down to left. Good. Face forward. Tilt right ear to right shoulder. And slowly left to left. Right to right. Slowly left to left. Right to right. Slowly left to left. Ooh. And right to right. Slowly left to left.
Ooh.
Oh my goodness. Yeah.
That's tense there, right?
Just a lot, yeah. I'll get you to bring your shoulders up for me, shrug them up, and slowly lower down. And up. Slowly lower down. And up. Slowly lower down. Hey, table, no one asked you. Alright, good.
Thank you.
Of course. Hi, Jess.
Hi.
How'd you find all of that?
I actually found it really great. I've never been to a spa, but I kind of felt at one point like, oh, if you want to feel like you're at the spa, go. I'm an actor, but I promise I'm not. I'm not paid to say any of this. I actually did have a nice time. Like
Good.
I was telling him with the massage. I don't know what it was. What was it called?
Smart Tools Instrument Assisted Soft Tissue Therapy. It has like a million different names.
But it was so soothing, and even the
massage gun.
The massage gun was just super nice. Having some of like my neck, I had never had like my actual neck adjusted. I've only had my back adjusted, and it was really relieving. And I feel like I'm like, oh my gosh, this is what my body has needed for a while. So yeah, I just thank you.
Hey,
I loved it.
I'm really happy to hear that. Right, I do get a range of people saying how they feel afterwards. Usually they feel like kind of sleepy, relaxed. Jess here feels like she just came from the spa. She hasn't been to a spa. She still hasn't after coming in today because this is not a spa, this is a clinic. But it's weird because I do have some patients say, what you did hurt, but I feel phenomenal afterwards, right? So it's really those after effects we're going for. But I'm happy you weren't in pain. Rather, you enjoyed what was going on. So do you have any kind of last minute questions for me before we kind of sign off, or maybe have you sing a song here?
No, I think I feel good, and you mentioned earlier that I'm okay to go work out after this.
Yeah. So usually, what I tell people after they're getting adjusted, either for their first time or like the first time in a long time, is to kind of go take it easy, just because everybody's body responds a teeny bit differently. So by all means, go work out, go get active. That is the healthy thing to do, is to load the joint once you've restored full range of motion. But don't push any PRs for today. Let's pretend like next time you're in here, if you do come back in, that we adjust you. You can go do whatever you want at that point because you know how you react, right? But I'd rather just have that one kind of observation period before I just say, hey, go squat heavyweight, right? That's kind of my own clinical opinion on that. Yeah.
Actually, I do have another question.
By all means.
How many sessions do you usually see at a time? Because I know you mentioned that you're not like a you know, you have to commit for a year or something like that. But like, how many sessions do you usually recommend per client?
So it's going to depend on what they are presenting with, right? Like, I do have patients who will call me like on a Sunday, emergency case, they can't walk. And those people, I usually recommend starting 3 times a week for 3 to 4 weeks. And that is largely because of the pain control component, okay? Theoretically, I wouldn't even need to touch that person, they would still get better, okay? But in the meantime, they are still in a lot of pain, and it is possible to decrease that pain through manual therapy. So that's why I recommend the three times a week. In a case like you, like, how long have you been dealing with this kind of neck discomfort for again? About a year, I think you said?
Yeah. With the pop
that specifically.
has been
the
like
past 4
about
months.
4 months-ish.
Yeah.
And this, like
The
my
traps.
traps, that's been something that I've had since I was a kid, because
Okay.
I used to carry like all of my
Tension
books
up there,
in
right?
my backpack to and from school.
So in this kind of like not really acute pain, but it's something you've been dealing with for a while situation, I usually recommend starting with twice a week for that same 3 to 4 week period. And the reason for that is because we do need to work enough of a therapeutic dose, similar to like how you take an antibiotic. You're supposed to take it every day in order to get the required effect, or the desired effect, excuse me. That frequency is what I've seen to be sufficient in dealing with cases of prolonged or chronic stiffness. Okay. Usually we're able to get things feeling a lot better in that time period, at which point we back off. So I always tell patients the ultimate goal of every treatment plan, and this should be true of every practitioner, is to see you as infrequently as possible, okay? Because if you are having somebody come in 3 times a week for the rest of their life for some very long period, you're not getting that person, excuse my French, fucking better. Okay, you're just keeping them on a cycle. So ultimately, that's why the goal here is to build people out so that they can, and then at that point, they can choose what approach they want, right? So me, I offer a preventative approach where if you're in here, maybe let's say once every 2, once every 3, once every 4 weeks, whatever's best for your body and your needs, we can decrease those rates of injury and aggravation and all that. Or we can take the will call approach, where if you'll say, Adam, it was good being in here, but I'll call you when I need you. Awesome, I'll be here, So it really is up to the individual patient's goals and what they want, whether or not they want to take that preventative proactive approach, or if they'd rather wait for symptoms to come back and see me. Of course, I prefer the preventative because I don't like putting people back together entirely, but it's up to you. So the answer there is twice a week, 3 to 4 weeks, backing off, and then you make the decision at that point. Do you want to go will call, or do you want to be preventative and proactive, right? That is, in my opinion, the way to do it. So therefore, that's the way I do it.
Yeah.
Does that answer your question?
Yes.
Good.
And
Okay.
I had one more question, and
Please.
I forgot it. As you were talking, I was like, I have another question. Oh, yes. How could I best prevent having like continuous tension in my own lifestyle?
So that actually, I'm glad you asked that, because I forgot to ask you that earlier. What does your day-to-day activities look like? Do you do a lot of desk work? Are you a high-stress type A person? What do you...
Yeah, I do quite a bit of desk work, and with like sending emails and editing like audition self-tapes and things like that, and watching TV. But I have like a hybrid, I feel like, lifestyle, where like some days I'm just hours at the computer, and some days I'm walking around a lot, running, maybe dancing, it's quite a hybrid, but not every day is quite the same. Although I do spend a lot of time like on my bed on my computer, or like in a chair on the computer.
Okay. So the most common reason that I find people dealing with very tight upper traps is due to, it is a postural component. Okay, now if you are doing those days where you're sitting and you're focused, you're zoned in, and are you a higher stress person? Sorry, I missed. Not really. You're more laid back.
No.
Okay, so we can kind of dismiss the stress component a little bit. But if you do find yourself in that kind of forward slouch posture for many hours a day, that can contribute to upper trap tightness. Now, the caveat is that there's actually no such thing as bad posture or good posture, all right? Like, a lot of people think that, like, this is bad. A lot of people think that this is good, all right? That's an outdated mindset. The only thing that can be bad about a posture is that you remain in it for too long. So what that means is that this is being perceived as a bad posture because it's the one that most people naturally adopt when they are sitting for prolonged periods of time. Therefore, they get symptoms due to being sedentary in that posture. What that means is that if you were like this the entire time, that good posture, you would develop symptoms in relation to being in this posture.
Right.
Therefore, the most effective way of dealing with that yourself is to actually find a way to consistently change up your position when sitting. Personally, I recommend an app to my patients. I'll tell you about it off camera. It's called Focus Keeper. I think I've talked about it on this channel before. But it is very effective at giving you a reminder to change your posture every 25 minutes. Confirms that you keep that change in posture, and it does this in a way that is non-intrusive to whatever workflow you're currently dealing with. So like obviously I don't like to set an alarm on my phone per se, because if I'm working away, suddenly I'm distracted and I need to get back into my flow state. Focus Keeper works around that. Okay. All right, so I'll walk you through that off camera. Any other questions?
No, that's good. Thank you for answering all of them. I kind of just threw them at you.
That's what I do here, right? I answer questions. So I think we might get her to sing next, but before that, we'll just, I guess I'll say thank you for coming in. Yeah. And we can kind of just end on a high five today, okay? Boom.
Oh, that was a good one.
That was a really good one.
Thank you for having me.
Of course.
Don't forget to like and subscribe.
Thank you, Jess. Bonus take of Jess. She's going to sing us a song whenever she is ready.
Yeah, I'll sing the song that I sang for the kids, the story that I mentioned earlier. I don't mind letting you down easy, but just give it time. If it don't hurt now, we'll just wait a while. You're not the big fish in the pond no more. You're what they're feeding on. So what are you gonna do when the world don't orbit around you? Ain't it fun living in the real world? Dun, 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 dun. Ain't it good being all alone? Ain't it good to be on your own? Ain't it fun? You can't count on no one. Ain't it good to be on your own? Ain't it fun? You can't count on no one. Ain't it fun living in the real world?
Wow! Holy shit!
Thanks for having me.
Oh my god, thank you for coming.
Of course.